There are a few things to consider when you're exercising in pregnancy, particularly in that second and third trimester. So the first thing you'll notice is that we're not going to include any exercises where you're actually lying on your back. Now, the reason for this is because the weight, particularly in your third trimester, can compress the major blood vessels that supply the blood to your uterus. That can make you feel a bit dizzy, sometimes a bit nauseous, and can also reduce the amount of blood flow going to your baby. So in terms of exercise, the risk versus the reward, there's really very little, and there's a lot of other choices that we can make. Now, don't be worried too much if you wake up kind of when you've been asleep and you're lying on your back. This is particularly for exercise. The second thing is how you feel. So how tired are you? What are your symptoms like on that day? If you notice you're particularly tired, maybe choose one of the shorter exercises, maybe choose something which is a little bit more mobility based because it just gets your body moving in a really gentle way without overstretching it. It's really important to listen to your body in exercise. So if you are doing some of these classes and you're feeling tired or you're struggling, take a break, grab some water, and just pause the video and start again when you feel ready to. You're doing a lot and your body is doing a lot during pregnancy, so it's really not surprising if you start to feel a little bit tired and even a little bit weaker. The final thing you'll notice is that we don't do any flexion-based abdominal exercises, so that kind of sit-uppy type position. Now, that's because it puts a lot of pressure, a lot of stretch on your rectus abdominis, so your main six-pack muscle. And as you're pregnant, your abdominals, as you can feel, are stretching and they're getting bigger. And what that does is it can lead you to a little bit of what's called a diastasis recti. And that's a bit of a separation or a bit of a stretch of that ligament, that tissue that is going down the front of your abdominals called your linea alba. It's nothing to be worried of. It's really normal in pregnancy because our abdominals have to stretch in order to allow the baby to grow. But again, in terms of risk versus reward, that flexion-based sit-up movement can actually encourage that to happen. So instead, we'll choose lots of other exercises that will get your abs going. Just remember, when you're doing all of these exercises, it's all about you. So take the classes slow, move as you want to, and remember, listen to your body.
Why not check out these related videos? Thanks for joining us, everyone.